Well, I think there are three big challenges for family medicine. First of all, there is the epidemiological transition towards more and more multimorbidity. People have 1, 2, 3, 4 chronic conditions, and that will be the rule and no more the exception in the future. And that will need an integrated approach, because you cannot tackle that with disease-oriented programs. Secondly, of course, the challenge is to find young doctors, young nurses that want to commit themselves to work in primary care. So at universities, at the training centers, we have to motivate people for the recruitment for primary care. And that means that from the very beginning of the training, we should confront people with exposure to the primary care setting. In Ghent University in Belgium, the first doctor they see is a family physician. The first patient they see is a patient going to a family physician. The first clerkship they do is a clerkship in family medicine. So from the very beginning, they see the importance of family medicine. Of course, we also will need other strategies. We will need to change the health system. Nowadays, the healthcare system is much based on hospitals. The switch to primary healthcare has to be made. Governments should invest in primary healthcare in order to strengthen primary care, as it is the most cost-effective level of care. That means also that the accessibility for the people of the primary care system is of utmost importance. So no threshold, no co-payments, but an easy access through a patient list system, so that people know to which primary healthcare service they have to go, to which family doctor they have to go. Finally, it will also be important that in the perception of the population, we see that the population knows what is the role of the family physician. It was amazing this morning to understand how in Kyrgyzstan and Tajikistan, even the medical students did not know what a family doctor was. How do you want them to be interested and motivated to train for family medicine as a career option? So we need to work at the different levels, and that means that at all the different levels, people should take their responsibility at the level of education, at the level of the health system, at the level of the population, to really make sure that we will have a health system that is responsive to the needs of the population, that is equitable, that is cost effective, that gives high quality of services, that is personal and people-centered, and that's sustainable for the future.